Okay, guys. Today we will be discussing about the opportunities for internationally trained dentists in the US as well as in Canada. So we can say about North America. Well, when we talk about the internationally trained dentist means anyone who is coming from rest of the world and whose colleges or whose dental schools are not accredited by the CODA, C-O-D-A. I will explain to you what is this CODA, what are the accredited schools and what are the non-accredited schools and what are the opportunities. And everybody is going to be treated in the same manner, no matter you have a master's degree or a fellowship or a membership, or just you are a simple graduate. Everybody is in their eyes same because your basic degree is not recognized over here. So let's start now. I'm going to record it. As I told you, it will be recorded. Acquiring a dental license in Canada, how it works. Well, first of all, you have to apply for the verification of your documents, and then the equivalency process starts. The first exam you appear, that is for assessment of fundamental knowledge. Then there will be two paths you can choose. Either you go for the direct license and you appear in another exam, which is called assessment of clinical judgment exam, or you apply to the universities on the basis of your AFK exam and definitely TOEFL or IELTS, the English language exams, you have to pass those. Then you apply to the universities. Over there, it is like 3 years or 2 years, depending upon which university you are applying to. You have a degree completion program, and after that, the process continues. Well, after passing if you are going for the direct license, after passing this assessment of clinical judgment exam, then you have to pass another exam, which is called NDECC. Previously, there was another exam, NDEC, it has replaced that exam. We also call it NDEC. Previously, it was ACS, Assessment of Clinical Skills exam. But NDEC has replaced that Assessment of Clinical Skills exam. No matter you are coming from the dental school or you have acquired the path of direct licensing, after that, you have to go for NDEB written and objective structured clinical exam, which is called OSCE exam. Later, NDEB, it gives you the certificate. It means you are certified by the National Dental Examination Board of Canada that you are now able to practice in Canada. It does not mean that you are going to practice. After that, whichever the province you wish to practice, like Ontario, Alberta, Manitoba, Quebec, wherever you want to practice, you have to apply to the provincial authority and they will give you the license. In Canada, dental practice license is managed by and governed by the provincial licensing authorities. NDEB just give you the certificate that now you are able to practice in Canada. Well, now they have another thing. Two universities, they do not accept the assessment of fundamental knowledge exam. That is University of Toronto and McGill University. The reason is AFK previously was giving a score which was on the percentile basis. They are no more giving this score. They say just that you are either pass or you are not able to pass this exam. Hence, to find out the cream, these two universities, they have switched to another exam which is being conducted by the American Dental Association, the Advanced Dental Admission Test, ADAT. And on the basis of the score of ADAT, they choose the candidates, and then they interview, they shortlist these students, and then they take those students in their universities. So how this NDEB equivalency process it works? First of all, you have to make a profile at this website, ndeb-na.brighttrack.com. Then they will ask you for the documents. You have to send them the documents in the prescribed manner. Every country, they have their own system. So according to Pakistani system, they will ask you to send the documents directly from the university. Which documents? Your 4 years mark sheets and one certificate from the university that you have acquired the degree from that university. Both of those should be in a sealed envelope sent by the registrar of the university direct to the NDEB office. Well, if they will find out that something has been tampered, then you have to start the whole process once again. Well, after they approve your profile, then they will send you an email that now you are eligible to appear in the assessment of fundamental knowledge exam. 5 to 6 months preparation is required at least. But some of my students, they were not confident and they took 1 year, even few of them, because of the language problem, especially coming from certain African countries or coming from Middle East. They also had the problem. Language problem was a major issue. So they took even 1 year or even more than 1 year. This exam is being conducted twice in a year, in the month of February and in the month of August. You have 3 chances to pass this exam. And passing percentile is 75%. Percentile means your result is dependent upon the, you can say, the result of other students or the knowledge of other students. If you are lucky and other participants are not that bright, other students are not that bright, then you will be having better chances to pass the exam. If your other colleagues who are appearing in the exam, other aspirants, they are very bright, then the bar is going to be raised. So we can say that at times even 65% would be considered as 75%, and at times even 90% would be considered as 75%. Hopefully, I am clear about this passing percentile thingy to you. There are 200 MCQs. Previously, the exam was being conducted with 300 MCQs. They have reduced the number, hence the chances of wrong answers also reduced. This exam covers all the basic as well as the clinical subjects. Then comes the assessment of clinical judgment exam. Well, at least 3 to 4 months preparation is required for this exam. Some of these students, they took even 1 year to pass this exam to get prepared. Experienced clinicians, they take less time. 3 chances are provided to pass this exam again, and passing percentile is also 75%. This exam is computer-based exam and it is in 2 sections. Both these sections comprise of case scenarios with the MCQs and multiple correct answers, as well as periapical and bite wing x-rays with the MCQs and multiple correct answers. So you have to choose whether there is a radiolucency at the apex or there is a radio opacity at the apex, if the endodontic treatment is appropriate or it is short or there are voids, or if a broken instrument is visible in the x-ray, or if there are proximal caries or facial caries or occlusal caries. The proximal caries, does it require the like repair using the restorative work, or only just by application of fluoride and change in the lifestyle, including the flossing and brushing twice a day, is going to heal the carious lesion, etc., etc. Well, in total, there are 150 MCQs, 75 in each section. More emphasis on the oral medicine and oral pathology when we talk about the case scenarios. They give you pictures of the pathological lesions like you can say a squamous cell carcinoma, erythroplakia, leukoplakia, lichen planus, etc., etc. And you have to identify on the basis of history as well as on the basis of the portion of the picture they have highlighted that what it is. Well, they follow the latest periodontal classification, which was introduced in the year 2018. And then they also ask you questions with this integration into the case scenarios about the medical emergency. They give you the history that patient is known diabetic for 15 years, or patient is hypertensive for 10 years, or maybe the patient is, you can say, having the history of angina pectoris or whatever, like all the medical emergencies they can incorporate. And then they create the scenario that during the treatment, patient is feeling retroesternal pain, or patient is unconscious or whatever. So you have to identify, kindly mute your mic, please, whoever is. So you have to identify the medical emergency, and then you have to manage as well as they will ask you, like the history of the patient is there, the medical history. So you have to also discuss about the how you are going to proceed with that particular patient, whether it is a cardiac patient or a hypertensive patient or an asthmatic patient, whoever this scenario is, whatever type of scenario is. So what would be the do's and don'ts? A question would be there, like in this particular patient, what would you keep in mind while making a treatment plan for that particular patient in your dental office? Well, one or two cases of orthodontics would be there. They are not very complicated, very simple. They just want to see whether you have an ability to find out if there is deep overbite or if it is open bite, or patient has a centric relation to centric occlusion shift, or patient has like just normal development with the flesh terminal plane, etc., etc. Or are you able to identify whether this patient is going to need the serial extraction, or we have to wait till all the permanent teeth will erupt and then we will go for extraction or non-extraction treatment, etc., etc. A lot much emphasis is on the pain of endodontic origin and its management. Like they will ask you whether the pain starts only with the cold stimulus, or the pain is with the cold stimulus as well as hot stimulus and is lingering, or patient is feeling pain upon biting. So whatever the scenario, then you have to identify about the situation. And then you have to give your management as well, whether you are just going to reduce the occlusion, like in case of some hyperocclusion and the reversible pulpitis, or are you going to perform the endodontic treatment, or pulpotomy is required, or pulpectomy is required, etc., etc. Well, they will also ask you about the doses of analgesics, antimicrobials, especially analgesics and antimicrobials. When we say antimicrobials, means antibiotics, antiviral, as well as antifungal. And you need to know the pediatric doses as well, because they trick you in the pediatric doses. They also ask you about the amount of local anesthetic you can administer to that particular patient, depending upon their underlying medical condition or depending upon their body weight. Then questions on the prescription writing, because that is a major issue over here. When we migrate from the other parts of the world, we don't know how to write the proper prescription. That is a major issue over here. And we love to prescribe like dozen of medicines. So that is why recently, like not recently, but like 4 or 5 years ago, they have incorporated a section into this assessment of clinical judgment exam about the prescription writing. So they give you a prescription, you have to see whether it is appropriate or it has some problems, like maybe even spellings of the medicine, its preparation, its dosage, its strength, or if the license number, say for instance, you have prescribed some narcotic analgesic, it's a big problem. You cannot just prescribe the narcotic analgesics like that. And you cannot carry the narcotic analgesics without prior information to the local authorities in your dental office. So if you prescribe someone a narcotic analgesic, your address, patient's age, and date of birth is not mentioned, then that is not going to be an appropriate prescription. So you have to learn how to write the proper prescription from the North American standard. Well, then comes the NDEC exam. The purpose of this NDEC exam is to assess the clinical competence of dentists trained in non-accredited programs. The new NDEC test center is located in Ottawa. Previously, ACS exam was being conducted at the dental faculties of different universities, and NDEB was paying them and hiring their professors to conduct those exams, like in University of Toronto or Western University or Alberta University, Manitoba University, then in Halifax, this Dalhousie, etc., etc. But now they have their own center in Ottawa. It is fully equipped, and this exam is being conducted throughout the year, multiple times a week. Previously, it was being conducted only twice a year, in the month of December and in the month of June, but now throughout the year. This NDEC can be taken an unlimited number of times in a 60-month period, but it is a very expensive venture, like maybe $10,000 plus is the $10,000 plus is the fee. The format and content of this exam is during the 2-day examination, you will perform 7 clinical requirements on simulated patients, the mannequins, in a clinical setting, and 10 situational judgment requirements. So component 1, the clinical skills, it will be comprised of a class 2 amalgam preparation. When we say class 2 amalgam preparation, it is not the way we are preparing in our clinics. They want to analyze the ideal cavity using at least 6-time magnification. Then class 2 amalgam restoration with proper carving, where you will be restoring the whole anatomy in amalgam. I mean, even at times they ask you to build the cusp in amalgam. Class 2 composite restoration, again same. At times they can ask you to build the cusp in composite. Class 4 composite restoration. Crown preparation. Crown preparation could be PFM, it could be all metal, or it could be zirconia, it could be all ceramic. On your own preparation, you have to make a provisional restoration as well. And then the endodontic access cavity preparation, it could be on a molar, it could be on a single rooted tooth. The component 2, situational judgment, the situational judgment component assesses judgment required for solving the problems in work-related situations. First of all, the patient-centered care. For example, you have to assess the caries risk. They will give you the history that patient is coming from a very humble background, parents are not very well off, the child is staying at home alone and is taking like 4 or 5 sugar-rich snacks during the day, and then patient has in last 3 months 3 or 4 new caries. So what would be the assessment regarding the caries risk? How will you manage this patient's need? Whether you will improve, first of all, like how will you improve their diet? What would be your advice to the parents? And then looking at their water supply, what is the amount of fluoride in their water supply, if some topical application of fluoride is required, etc., etc., and if some restorable caries are there, so you have to restore those as well. So you have to make a complete treatment plan. Gather the data, develop a problem list, establish the diagnosis, sequence the treatment plan as well. And how to maintain the record keeping is a very major thing over here, because a lot of suits being filed against the dentists. So suits being filed regarding the like treatment. If your records are not appropriate and you cannot produce those in the court, the case will go against you and you may be paying millions of dollars to the patient. Well, after that, the professionalism, like respond to the ethical dilemmas, like say, for instance, you are working in like multi-practice clinic where a patient is being referred to just one specialist, and probably the referring dentist is getting some kickback from the specialist, etc., etc. What will you do? Will you just keep a blind eye on it, or will you report it to the authorities, etc., etc., or will you talk about that to the management of the clinic? So all these type of ethical dilemmas, or like other problems, a dentist is having an affair with the patient and all those things, like all these major problems, major issues which we face in this part of the world. Or maybe a patient comes to you, because it is a multi-ethnic society over here. A lot of spousal abuse is being diagnosed by the dentist. Like a lady comes to your clinic with multiple injuries on the face and a broken tooth, and upon query, you found out that it is because of the spousal abuse, but the lady is very scared and she does not want to go through the all police and all that drama. So how will you manage? And you need to refer it to a specialist. If you will not tell the specialist about it, so you will be in trouble. And if you will tell the specialist, the lady is going to be very angry because she does not want to involve the police, etc., etc. So all those type of ethical dilemmas. Then how you are going to write a referral letter, how you are going to use the social media to promote yourself. It should be very positive, not in a way that you are overrating yourself, you are overselling some product, you are making yourself as if you are better than other, and you are making someone really at a low level, you are comparing your work with someone else's work, etc., etc. So how you are going to use the social media appropriately. So all those questions will be there. Communication and collaboration, maintain the privacy, maintain the records, write a referral, and then how to write a lab prescription. We will discuss it just a minute, Ali. Let me finish it and then I will come to your questions. Well, I was telling you about the writing a referral lab prescription. Another problem with our dentists coming from our part of the world, we don't know how to write the lab prescription. And over here, if you are not going to write the proper lab prescription, lab is not going to start the work. Discuss the treatment with the patient, get the informed consent, then demonstrate cultural competence. Like, say, for instance, a lady comes to you who is fully clad and she says that, sorry, I do not want any male dentist. If you have a female dentist, then only I will get the treatment. Well, some of the people, they will get offended, but being a multi-ethnic society, now we have started accepting the fact that some of the cultures, the ladies, they do not want to even remove their hijab or whatever, the niqab from their face, because they don't want it in the front of any male dentist. how to interact with the staff. If you are going through some rough time at your home, it should not be revealed in your dental office. How you give the post-operative instructions after some procedure, maybe an extraction, a wisdom tooth removal, or maybe some minor surgery is done, or maybe some filling is done. So what would be your post-operative instructions to the patient? You have to write those. Then practice and information management. Manage the patient records, follow-up protocols. Like say, for instance, patient is a chronic periodontitis patient. So after how many months will you have performed the scaling and root planing? After how many months will you recall? Or the patient had some like advanced periodontitis, which you refer to the periodontist. Now patient is your patient. Patient comes to you. So who is going to see the patient first? You or the periodontist? So all those things you have to keep in mind. Then evidence-based decision. Evidence-based medicine was actually started in Canada at the McMaster University in the year 1970 sometime. And here the evidence-based dentistry, it carries a lot of weightage. You need to go through the research work, and then of course attend the conferences, workshops, and you have to learn from the mentors that how the new procedures are being incorporated and how the evidence-based practices being done. Like say, for instance, something they say, now it does not work anymore. You have to switch to this and try this new material, etc., etc. Health promotion. Examples like demonstrate an understanding for social determinants of health, promote access to care for all individuals. Like say, for instance, patient is smoking 20 cigarettes a day and patient is an advanced periodontitis case. So how will you talk to them about quitting the smoking? How can you help using the those nicotine chewing gums or the nicotine patches, etc., etc. Promote access to care for all individuals, promote measures to prevent oral diseases, injury, advocate for patients. The scenarios in the above table are example, but they do not reflect all the situations. Situations could be different, but you need to have at least this idea in your mind. Then comes the OSCE and written exam. This exam is mandatory for every dentist, whether they are coming from the direct license track or they are a graduate of a dental school. This is a 2 days exam. There are 3 chances to pass this exam. Again, the passing percentile is 75%. On the day 1, same MCQs, just like the AFK exam. On the day 2, it is OSCE exam with multiple stations are being said, and there are problem-based questions or case scenarios with most appropriate answers. There could be an OPG over there, and they want you to see the OPG in the right manner. Or it could be a periapical, and they can ask you, okay, this periapical, how you are going to identify which tooth and which side. They will give you a physical periapical. So you need to know how to look at the notch and how to find out the appropriate side. Because keep in mind one thing very important, though the digital dentistry is in practice, but if someone has to go for the lawsuit, court does not honor the digital dentistry. The reason is a lot of photoshopping being done in the past, and just to trap the dentist, and certain things like they were not right. Hence, court needs the physical x-rays as an evidence. You need to know how to read the physical x-ray. Even some of the universities in their bench exams, they ask you to read the physical, periapical or bite-wing x-ray. Upon completion, NDEB awards license to practice, but don't guarantee. Yeah, even in this, they will give you like some filling, which would be under-contoured, which would be having open contact, or which could be having a overhang, or maybe a crown with open margins, or the crown which is having subgingival margins, etc., etc. So they can ask you what are the problems, or maybe a provisional crown which is having a reduced occlusal height. so they can ask you what is the problem in that. So upon this completion after passing this OSCE and written exam, NDEB awards license to practice, but don't guarantee. Further, provincial authorities, they have their own regulations. So whichever the province you want to practice, you have to go to their authorities, and then you can ask for the license over there. Well, the alternate path, the dental school for 2 to 3 years after passing the AFK exam. Requirements, Canadian citizenship or PR. Only University of Manitoba has some seats for the international students as well, but it is very, very expensive if you are not a PR or a Canadian citizen for the University of Manitoba. And mostly those seats are also being filled by the Canadian citizens or the PR card holders. You need to have a good GPA from your back home, from your university, the university where you have graduated in Pakistan or anywhere in the world. Then you have to pass the TOEFL or IELTS exam. Every university, they have their own criteria, very highly competitive because seats are limited. University of Toronto, they have 30 seats. Manitoba, they have 6 seats. Alberta, they have 8 seats. Dalhousie, they have 10 seats, but usually they do not fill all the 10 seats, at times 9 seats or 8 seats. Western Ontario, they have 25 seats. McGill, it requires ATET exam, and they have like 7 or 8 seats. Now, even the University of Toronto, they also require ATET exam. They do not consider the AFK exam. Before applying, you need to have the documents like your degree, your 4-year, these, what do you call it, the transcripts, which we call here the mark sheets. You need to get those assessed from the WES, and the assessment would be course by course. So you have to submit that as well. Then bench exams and interview. Every university, they have their own exam for selection. University of Toronto and McGill University, they just go for the multiple mini interviews. And they consider the GPA, a lot of weightage is given, and then high score in ADET for UFT and ADET high score for McGill as well. University of Western Ontario or Western University, prior learning assessment exam, 2 days of the practical exam with 6 exercises on typodont, and then interview. They conduct their own course to train the candidates for this PLA exam. Dalhousie University, 1 day of extreme stress with 2 exercises on the typodont. One is a class 2 cavity or class 3 cavity preparation, and one is a crown preparation. It could be all metal, it could be a PFM, it could be all ceramic. And then one written exam where they will ask you to write down the referral letter, as well as you have to write the patient's record, how to keep the record. They will give you a case scenario, and then they will interview you as well. Interview is recorded. Interview is about your personal life as well as about your professional life, and they ask you certain case scenario based questions in the interview as well. Then University of Alberta, 5 days of extensive practical exam, extremely stressful 5 days with an OSCE type evaluation as well. Manitoba, 2 days of exam where you have to be doing a practical work as well as written, and an interview is being conducted. Cost for direct licensing, people ask this question a lot. So first of all, you need to pay NDEB a certain amount of fee for the evaluation of your documents. Then you have to pay fee for the AFK exam, fee for the ACJ exam, fee for this NDEC exam now, fee for the OSCE and written exam, study material cost, and the preparatory courses fee, dental materials, instruments, typodonts, simulated teeth for practical and training course. So all that cost adds up. Rough estimate is somewhere between 40,000 CAD to 60,000 CAD before you will either enter the university or you will pass the direct license exam. Time required for the direct license exam, if everything goes smooth, 18 to 24 months, like you do not fail any exam. Cost for the university program, apart from that 40,000, which I have told you in the beginning, fee for the evaluation, fee for the AFK exam, all that Then study material and prep course fee, university fee, books, residence, computer, instruments and supplies. Rough estimate is for the university 200,000 Canadian dollars. Time required after the AFK or ADET, 1 year gap is there before the classes start. And then 2 years of schooling or 3 years of schooling, depending upon the university you choose. Now, acquiring the dental license in United States. Accredited and non-accredited dental schools. The Commission on the Dental Accreditation, which is called CODA, it serves the public and profession by developing and implementing accreditation standards that promote and monitor the continuous quality and improvement of dental education programs. By reciprocal agreement, programs that are accredited by the Commission on Dental Accreditation of Canada are recognized by the Commission on Dental Accreditation, USA. However, individuals attending dental programs in one country and planning to practice in another country should carefully investigate the requirements of the licensing jurisdiction where they wish to practice. Again, just like Canada, in United States, they have regions like the Northwestern region, Western region, etc., and they have their own jurisdiction, whether they are accepting the Canadian university or they are not accepting the Canadian university. Dental studies in the United States, if person is going from the high school, so after high school, there is 4 years of university in the health sciences, but it does not guarantee that you will go into the dental school. You have to appear in an exam which is being conducted by the American Dental Association, that is called dental admission test. After passing that, you apply to the dental schools, they will call you, interviews, your personality test, your dexterity test. After that, if you are one of the successful candidates, then 4 years of dental school. And then you have to appear in the American boards, and then you have to give the regional boards. For the non-accredited programs from where we people are coming, the internationally qualified dentists, either we have a BDS degree or DDS, like in Iran and some parts of the Middle East, they award DDS, but those DDS are not considered equivalent to the DDS from Canada or America. They are all being treated in the same manner. Steps for the foreign qualified dentist. First of all, you have to go for the documents verification. There are two authorities, ECE and WES. ECE is mandatory, but if you are going for the WES, that is also okay. But ECE is mandatory to appear in the exam. Then you have to get the dent pin from American Dental Association. You have to apply for that. And what is that dent pin? Dental Personal Identifier Number. It is a unique personal identifier for professionals and students involved with the United States dental education system and standardized testing programs. Previously, there were two exams which were conducted by the Joint Commission of National Dental Examination, NBDE Part 1 and NBDE Part 2. Well, as of September 4, 2020, the JCNDE announced that it will extend the last date to take the NBDE Part 1 to December 31st, 2020. After December 31st, 2020, NBDE Part 1 was not being conducted. For all qualified dental candidates, that is regardless of whether or not they were trained by the CODA accredited dental programs or not. The NBDE Part 2 will be discontinued on December 31st, 2022. Now, a new exam, which is INBDE, is introduced. So JCNDE conduct this exam. It integrates content from the biomedical, behavioral, and clinical sciences to replace National Board Dental Examination Parts 1 and Part 2. The purpose of the Integrated National Board Dental Examination mirrors that of the NBDE program to assist the dental boards in determining the qualification of individuals who seek licensure to practice dentistry in United States. Well, after that, you have to go for the TOEFL only IBT exam. No other, no paper-based or no computer-based, IBT, internet-based test. Written, speaking, reading, and listening. There are 4 sections. Every university, they have their own criteria, whether they want 25 in written or they want 20 in written. Similarly, speaking, they want 22 in speaking or 20 in speaking, reading, listening, everything. Well, after that, you have to apply to the universities. There are two types of universities, the capped universities and non-capped universities. What is this ADEA capped? The ADEA capped is centralized application for advanced placement for international dentists. It is available to all the individuals applying to the participating programs. Applicants to ADEA capped are internationally educated dental graduates who wish to practice dentistry in the United States or Canada. ADEA capped includes advanced standing programs, which are typically shorter, means either they are of 2 years or 3 years. So you will be joining the university either in the first year or in like after first year exam, or you will be joining after the second year exam. So then you will be awarded DDS or DMD degrees. So how this capped application portal it works, you have to make a profile, then you need 3 letters of recommendation, and those are electronic, coming directly from your referees. They will, once you will nominate them, you will provide their email address, this capped, they will send an email to your referee, and the reference letter is going to be uploaded by the referee directly. You have to make a statement of purpose. This statement of purpose is basically how you sell yourself. So you have to use the proper wording to tell about your achievements, to tell about what you are going to do, what are your goals, why you want to move to United States of America, why you want to join some university, etc., in the United States. So you have to be very, very careful, and it should have some professional touch so that it is not going to have like some repetition of the words or grammatical mistakes, all that, because that reflects what you are. Statement of purpose is very, very important. Then your TOEFL score, 100 plus is safe score. 105 is a good score out of 120. So 105 is a good score, but higher the score, better the chances. Then your NBDE exam result. INBDE, either pass or fail. It is not giving you any percentage. It doesn't give you the score. Your ECE evaluation, you have to upload that as well. Selection of the program from the list available. Well, after that, say for instance, you have chosen Boston University. Boston University will send you an email within 48 hours, and they will ask you for the supplemental application. I'm just giving you an example. So it would be an application form, which could be, depending upon the university, paper-based or the electronic application. Letters of, again, recommendation required, and preferably they should be different from what you have already submitted. It could be one from your professor, 2 with whom you are working at the moment. Yes, in CAPED, they want 1 letter from the dean of the university, from the dean of the dental school you have attended. The reason why they want this, they just want to check you are not telling them. They don't have time to go back into every applicant's school and ask them whether the person was a student, like registered student or not. The letter of recommendation that tells the story. No matter, like say for instance, when I applied, my Professor Chima, he was no more there, but I got from Professor Wahid, just to show that I was a student of that dental school. So that's how it works. So letters of recommendation, supplemental application fee, and some other, whatever the requirements of that particular university is, you have to fulfill those. Then they will call you for an interview or a bench test, or maybe both, depending upon the university you are applying to. And on the basis of all that, final selection is being done. Now, question comes, what are the finances involved? Either you can fund your all the study if you have adequate funds from your own funds, or you can take the bank loan. If you are not an American citizen or a green card holder, then you need a co-signer. It could be your friend, it could be your spouse if they are working in the United States, or they are a green card holder or citizen. It could be any relative, etc., etc. But a co-signer is required for the bank loans. Well, after that, degree completion, and then you have to write the regional boards, and then you are ready to practice in that particular region. ADEA pass, the American Dental Education Association postdoctoral application, its support services, which is called ADEA pass, is a centralized application service for individuals applying to advanced dental education programs. ADEA pass simplifies the application process by allowing applicants to complete one standardized application rather than individual applications to each program. The appropriate tests, INBDE, if patient if the aspirant has already taken part 1 or part 2, they are also eligible to apply. Then TOEFL with very good score, 100 plus. GRE, unofficial self-reported test results only. ADAT is preferred by some of the universities. The Advanced Dental Admission Test is an admission test designed to provide advanced dental education programs with a means to assess the applicants. After going through this specialty training for 2 years or 3 years, then you are eligible for the Diplomat of American Boards exam. Board certification means that the specialist has met the highest requirements of competence within the specified field. Achieving the status of board certification demands an immense amount of dedication and hard work beyond the regular rigors of specialization education. Now, I tell you one thing very important. If you are only and only looking for this specialty program, you have very limited chances of practicing in the United States or in Canada. The reason is they want, firstly, your basic qualification to be North American. So that is why I always advise my students or the people who come to me for advice, go for DDS in the beginning, either from Canada or from USA, or if you are intending to migrate to Canada, then go for the license exam if you want to. So whatever the situation is, but firstly, make your foundation strong and then aspire for something bigger. Well, direct licensing in the United States only in few states on the individual basis after the NBD exam. It is not available to everyone. Few people they got because they had 2 years full-time masters from England. So that's how I know some of the Pakistanis, they are working in the United States after getting the direct license in some of the states over there. But firstly, they got 2 years full-time. I'm not saying 2 years part-time, 2 years full-time degrees, clinical degrees from England. And then they came to the United States and they were granted the permission to go directly after passing their NBDE part 1 and part 2 to go for the state board exam. And then they were eligible, like which we call now the regional board exams, and they were licensed to practice in that particular area. General dental residency programs for the foreign trained dentists. The advanced training program for foreign trained dentists does not focus on specialization, but rather all subjects taught in dental school. It is basically a bridge course making an international dentist equivalent to any US trained dentist in. With this program, you will repeat 2 years of dental training to be eligible for dental licensure in the United States. Well, these programs are off and on basis available, and there are certain states only which honor these programs. So before getting into these programs, first of all, find out where you will be honored, where you can go and practice after passing their regional board. So when I made this presentation at that time, Howard University was offering a program like that, Tufts University, Metro Health Medical Center, Abingdon Memorial Hospital. But if you are going to Google it, you will find many other centers as well. it is again on the individual basis, a lot of favorism over there. They accept you, they don't accept you, it all depends. But this is another alternate path. So choose your path wisely. There is no shortcut to success. Now, somebody asked me about the ADET exam. Before we proceed further, I tell you, ADET is being conducted by the American Dental Association and is the exam honored by University of Toronto and McGill University for their admissions. They do not honor AFK anymore. ADET, it is being conducted from the March till August every year. And it is quite a stressful exam of 4 hours and maybe 15 minutes or something like that, but definitely more than 4 hours. If you have got your assessment done by ECE and your documents, the verification is with the American Dental Association, you are eligible to appear in ADET exam. ADET exam emphasize too much on the basic sciences as well as on the epidemiology. A lot of research methodology questions and epidemiology questions, dental literature-based questions, they are over there. So you have to put some extra effort while preparing for the ADET exam. This ADET exam, it gives you a score on the basis of 200 to 800. They say, the American Dental Association, it says that if you are 500 plus, then you are safe. But I always tell my students that 550 is a safe. By the grace of God, in the last couple of years, some of my students, they even scored 630 plus, and they're like sitting in one of the good universities. Even the American universities, if other than INBDE, you have passed ADET exam, then you have better chances to get into the university. But you need to have INBDE as well as ADET. Is it clear to everyone? Yes, no, maybe.
Yes, sir. Dr. Nagman, are you done with the presentation?
Yes, I am done.
Thank you so much for this exceptional session. It was very informative.